ahead and do this. So it's obviously unusual time. Is everyone on this call working from home currently?
Yes.
How, and real quick, what's the expected duration of working from home? Is it indefinite, or do you currently have a window?
Minimum 3 weeks with reassessing on April 6th.
Currently
End
indefinite.
of March 31.
End of the month, indefinite.
Definite.
April 30th.
Definite.
And just out of curiosity, how many of you have actually spent much time working from home before?
A little.
Minimal.
Very small amount.
Certainly not
Yeah,
with
a little bit.
two of my kids at home with me. And my husband.
Exactly. I haven't tried to juggle working remotely and homeschooling at the same time.
Oof.
That's true. That's a unique challenge. All right. Well, so as you've gotten into it, what sort of things have you found that have been helpful in making you a little more successful in the whole working from home arrangement?
I would say video meetings with my teams more frequently than not, trying to keep them connected.
Definitely setting up a routine for myself every day so that I know I'm going to be at my desk at a certain time. I know I'm definitely going to break for lunch, which is something I didn't do in the office. Just keeping a strict routine.
Maybe we should ask, are we all wearing pants?
Oh,
They're pajama pants, but they're on.
Pants,
Okay.
yes.
But that's a bar that sometimes is just high enough. Angela, were you going to say something there?
I was just going to say, I think the importance of taking mental breaks throughout the day, whether it's, even if it's just, if the weather's bad outside, even just standing outside and breathing fresh air for a few minutes is important. And taking time to laugh. You have to take time to laugh because we're being hit with so much stuff on so many fronts and we can't control a majority of it. So I think the importance of just finding humor in things, that it's just like, okay, here we go again, and just trying to make light of things, but that taking that mental break for yourself, I think is really important, and encouraging your team members to do the same.
Yeah. One of the things we've been doing is Slack messaging, and every day we've been sending each other memes and funny things. And for the parents out there, I've been sending out links to Story Online and other things like that they can share with their kids. So we're just trying to stay in communication beyond the work itself, just like socializing through Slack.
Right?
Yeah, we
Agreed.
using Slack, and I took this hint from Eliza, who started a couple days before I did, but using Slack to do a poll each day with my team that is really not at all work related. The one I borrowed from Eliza was, how much toilet paper do you currently own? And is it normal? Is it scary bad, scary good? Maybe a little extra. And so that sort of helped folks feel connected in a way that's sort of water coolery. And so to Angela's point, sort of finding the humor, but also it's now become part of our routine, and that, well, 2 days in a row now I've posted a poll. Today was about superpowers. What superpower do you wish you have? And so just finding that moment to connect on a human level with folks. I think the other thing that, to answer your question, Mark, I don't feel like I have figured it out yet. And so I'm allowing myself some grace this week and the adjustment of it all, and that I'm not going to get it right every day. And each day we're learning. So my husband and I have learned that we can't both be in the same room at the same time on calls. And so that meant we had to figure out how to extend the wireless so that we could be in separate rooms and still be on calls, and some of those pieces. And again, we have 2 young kids. So we have a 5-year-old and a 7-year-old home with us. And today we just decided screen time was going to win because we both had so many calls that we just couldn't be both parents and teachers and workers all at the same time. And so thank goodness for Netflix. Do
you find that there's a different kind of intensity to the work from home that isn't present in the office? Maybe it's something related to just the feeling of, am I doing what should be done because you're in a new environment? I don't know. Do you find that too?
Yes, I do. I was going to say, I feel like I've got so much technology coming at me in so many ways via email, and usually in the office, it's email, or if it's your desk, it's IM, for us Skype. But now we've got Zoom meetings popping up. We've got the Teams chats and calls.
And then our switchboard operator has her switchboard at home with her. So she's transferring calls from donors that don't want to leave a voicemail, that need to talk to someone. And the juggle of trying to feel like you're in all these places all at the same time, and how do you not drop any balls, it's going to take me a while to get used to.
And I think it's important not to ignore the fact too that we've got this added stress layer that we're all experiencing, that I think is making us feel even more intense, right? I know that the first couple of days that I was home working, I was having little panic attacks around 4 o'clock in the morning, waking up thinking, okay, I have to remember to do this, and I have to do this, and I have to do this, and I have to make sure nobody is coming into the house, and and nobody's going out, so there's this added level of tension.
Yeah, definitely.
Yeah.
Scott, you want to say something?
Yeah, I was just going to sort of pipe in on two things that we've talked about. One is sort of setting boundaries and knowing, like, I know that my modified schedule is 9 to 5 at this point. When I'm in the office, I'm on earlier and I go later, but I needed to sort of limit that time so that I'm not constantly popping in and checking things in the day or earlier in the day. And with that, sort of being more intentional with my communications to my teammates, my colleagues across the organization, because we're losing a lot of that banter that happens in the hallway, the water cooler stuff. Yeah, we want to know what you're binging, what books you're reading, what restaurants you went to, but also, somebody's walking by coming out of a meeting talking about a program. I'm like, oh, wait, we're working on that too. Can you guys pop in here for a second? And so being more intentional. So when every meeting we finish now, we kind of run through our notes and we're like, oh, make sure we let this person know, let that person know, so that we don't lose as much of that. Prior to this, this situation we're in, many of our frontline fundraisers, our relationship managers, were remote across the country. And we were often hearing this from them, that they didn't feel connected. And now all of a sudden we're all in it together, and we're developing that. We're understanding more where they were coming from. And I think that we're going to come out of this better as a team in terms of our communication. But in the meantime, it is a little bit of a struggle. We are keeping it in the front of our minds of letting people know and then reaching out when we need to.
So that's a really good segue, Scott, to kind of the second question. And I want to actually take the second question a little further. The second question that we wanted to talk about was just how are you adapting your donor relations, your engagement efforts in light of this? But I also want to add to that, what do you think are the long-term implications of this? This is such a widespread, pervasive thing that my gut is it's not going to leave without leaving a mark. And so I'm wondering how you think our work might change in the long term as a result of this.
If I can jump in, I think coming from a healthcare facility and an acute care healthcare facility, it's interesting because we're looking at how we deal with this, how we support the staff at the hospital, how we deal with our donors who are calling us to try and get them as much information as possible because they see us as their front door to have access to that. So we've been doing things like creating town halls, virtual for our VIP donors and for the broader base. We're looking at ways of engaging and thanking the staff on the front line and actually changing our work more, not changing our work, but adapting our work to be much more sort of like staff inclusive, as well as we always steward our staff to some extent, but this is above and beyond in really amazing ways. The fact that most of us are going to be deployed to screen patients coming into the hospital at a given time. So it's an interesting time. So there's a little bit of other duties as assigned that's happening here that we're working with. And one of the other things that's interesting is the calls that we normally get, the calls that I certainly normally get, because I'm on every publication that goes out is my phone number, are often, yes, it could be about your tax receipt, but there's much more. Yesterday I had a panic call with a donor, and it wasn't about his donation. It was about his father's cancer treatment and trying to help him manage the healthcare system. And so that's really, in a lot of ways, as heartbreaking and scary as all of this is, there is ones with our donors in our community around us as we all rally together. So I actually think that the very different look that's going to come out of this will likely be stronger relationships. If you know, it's all of us who band together to help each other are going to come out with a much stronger sense of community and connection.
Right. I agree, Jessica. And I think, Angela, it was you who made the comment in yesterday's call about how we as donor relations professionals really have an opportunity right now to step up and, you know, it goes beyond our relationships with, you know, our constituencies as donors, but how do we care for them in times like today, when there's a crisis? It's, you know, rethinking how we do what or not do pledge reminders. I know that was a question that I saw on the listserv. I think it was just yesterday, and we've decided to suspend those altogether, at least for the foreseeable future, and then maybe in late April or May, changing the wording of those, and just show how much we care about our donors as individuals and what they're going through, and acknowledge that first and foremost.
Yeah, I agree. I think we were talking yesterday, some of my colleagues and I were talking about the fact that, you know, we're focused so much on telling impact, and that's very important. That continues to be very important, but we're in a really unique space right now. So taking this opportunity to maybe pause on telling the traditional impact story and instead switching it to a mindset of, donor, you've been here for us all these times. Now let us try to be a resource for you, whether that's working with our College of Education and how are our teachers across the country that are alumni and donors working through this and providing resources and support to help them, or our donors that are all of a sudden trying to figure out how to be homeschool teachers, as some of you referred to earlier, and knowing that we've got simple resources, even as simple as partnering with our Alumni Association, who has a link on their website to coloring pages of our mascot and things that, you know, we can push those out, and it's easy for us to push out and say, hey, maybe this is something that's helpful to you. But taking this time for that self-care that is so important, and how can we provide that for them, and using that as a focus, and then going back to the impact when it's appropriate and when it feels right.
I also would add, I think this is a time for us to show hope, and I think we cover the nonprofit spectrum with what we do. And to Jessica's point and Angela's, and I think all of us would say, a lot of our donors are looking to us to have answers and to feed off our reaction to this crisis. And I think sharing stories of hope and highlighting the great work of our community right now and how they are bonding together to help solve. I mean, I think, again, being part of a healthcare operation, you see people who are just trying to rally and help our caregivers, and they're focused on resiliency efforts. And I think really sharing those stories as well to just build strength and hope in our community is really important.
That's making me think of the posting that Debbie Myers had in the listserv about where she sort of shared two types of communication and her reaction to them, and sort of just showing our humanity. When I talked earlier about sort of having grace for myself, I think just acknowledging that we're all trying to figure this out as we go, and being that kind of real with our donors, with our teams, is such a big part of navigating this. Is just having that level of humility and humanity at the forefront of everything that we're doing.
Yeah.
Speaking of humanity, we just lost Angela. I'm hoping it's not permanent, but
I think
we did
it's
just
also,
lose Angela.
sorry.
Go ahead, Roberta.
I was going to say, it's also an opportunity for us to prove our value to our teams. You know, I think that, you know, we're often thought of as back office, and right now I feel that we are the forefront, right? We are going to be supplying for our frontline fundraisers the material that they need so that they can stay in touch. And you know, something that, you know, we've been doing from the central office, sending out scholarship notices and letters from the kids over the years. We're now going to try to deploy that so that the frontline fundraisers have those as tools that they can use to reach out to people, you know, giving them that extra opportunity. So, you know, I think that the spotlight's going to be on us a little bit more in the next few weeks and months.
Yeah. I'd be interested, Scott, just sorry to put you on the spot. I'd be interested to hear from you how as a non-higher ed, because of course donor relations, the ADRP tends to be dominated by that, but certainly you're in the thick of it too. How does it look from the National Parks Foundation perspective? What's the impact on you, and what are you doing to adapt?
So we're in a pretty good place in terms of being able to continue our operations for the most part, which is really good. We've been over the last year, putting in place new systems, which are really being tested right now, but so far so good. We're probably 90-95% at capacity with everything that we're doing. So that's really great. The organization we've already talked about it. Several of you have talked about it. Our messaging has shifted a little bit. We're still talking about things that are going on. The parks are still there. They've been there for generations, and they're going to continue to be there, and they're going to continue to be places of solace, hope, and healing for people. So we've really been putting that in the front and center of our institutional messaging, so that we can talk about the importance of why these places are there, and keeping that at the heart of our mission in place. So I think that's one big thing that we're doing. I just had a call with our president and CEO earlier. It was a collaborative cross-team conversation about who does he know, who can he call, and based on the level of relationships, he'll call some people this week and just be like, "Hey, how you doing?" Just checking in, very personal. The people that he's got a more distant relationship with, we're going to wait a little bit. Let everybody sort of adapt to the new world. One of the things that we were talking about is just how different the world is in just a week. This is so fast, and we're adapting, and we're giving ourselves grace. Thanks for saying that, but we're able to continue the majority, and right now it's about the relationships and just checking in on people that we know, and then reminding them the parks are there. Some of the services are being closed for good reason, but they'll come back.
Yeah, that's a good word. Yeah, the world did seem to change very, very quickly, which is interesting. I had heard a description that this virus thing is a little bit like a natural disaster in slow motion, and yet in the past week it hasn't felt slow motion. It's felt like it's been a runaway train, but nevertheless. So it's a new world. The last question we wanted to talk about is just, if you're managing a team, which I think all of you are, kind of what are the tasks and projects that you find you are able to get done remotely? Maybe some of the ones that you just can't, but in particular, what are you able to get done remotely, and how are you doing it, either the same or differently? Anybody want to go first? Otherwise, I'll pick someone. Thanks, Terry.
So I think one of the things, obviously, that we're trying to do is first and foremost, be nimble for our teams. But also, one of the ways we've really been able to partner with our Marcom team, for example, is to start building our gratitude library. And there are donors who are, in our world, at least I should say, in the healthcare arena, who are truly stepping up in a magnificent way. And so, we always need gratitude language and stories to tell. They may be different and have a different tone right now, but one of the things our team is doing is really building that library and looking how we can share them electronically. So obviously we're not in the office, so mailings and snail mail is just not going to happen right now. So how are we able to tell those stories electronically, and again, let people know that we're still trying to serve a mission here and take care of kids in Colorado. So building that messaging has been really important for us. And the more we can accumulate, because things are happening so rapidly and we have a pool of information to share, is how we feel one of the ways we can help right now.
One of the things that we're doing, if I can jump in, is on top of doing what we can for new messaging, doing what we can to actually find ways to engage our donors with our staff, with our patients. We know that there's a lot of work we can't do. A lot of us don't have access to the donor databases. A lot of us don't have access to, there's a lot of challenges in our way. So we're also taking the time to sort of, all of those big strategic dream projects that we've had, we're all starting to take the time to focus a little bit on that because we have time to. If you've got new processes or policies that you want to develop or start to implement, now is the time to be able to do that so that when we all get back and we're all running full steam ahead, you've got all of those pieces in place so that you can slowly start to roll them out. We never are given the gift of these levels of down think time. We're always reacting so quickly to everything. So it's really, there is a part of this where as terrifying as it all is, we're all also being given the opportunity to take a breath, to actually take a breath and to step back and to sort of look bigger picture at our own lives, at the work that we do, at all of those pieces. So I just think there's a great benefit to doing that.
It's also given us an opportunity to look at, really unite our decentralized units. Some of those who are doing stewardship outside of our central office, to pull everyone together to talk and collaborate about how we're approaching the crisis with our donors, because not that we haven't united before, but it was different. I think this has really drawn us together very quickly, but given us an opportunity to really collaborate more so than perhaps we have in the past with some of our outside units.
One of the things we've been doing is we're building a Teams site that we have it private to my team at the moment, but hopefully later this afternoon we're going to launch it to the rest of our development officers. And we've created channels in the site, so it's broken down by gratitude, engagement, gift ideas, just some of those random things that we know are resources that they come to us for, and we try to push out, but trying to collect that in a way that's manageable and easy for them. So we've created that site, and then our hope is that once we push it out, the development officer to share other ideas or things, tips, tricks, that sort of stuff. So we're looking at social media and what we're seeing out there, ideas from other organizations in industry, and looking to sort of populate that, and we'll continue to push new ideas to that on a regular basis, but having it all in one spot that's easy for them to be able to access is something that we've been collectively working on and that we're excited about.
Great. All right, I want to just ask for if you had one more, so just monitoring our time here.
Yeah,
Roberta, were you going to say something?
Yeah, I was going to say something. So one of I think the biggest challenges I'm having right now, and it's evolving, is with my events team, because we've had to postpone and or cancel just about everything that was slated from now until the end of June. And the university is also has done away with commencement for this year, which is heartbreaking. But we're trying to think of ways that instead of bringing people to campus, so we can bring campus to them by sending them videos, putting together more video messaging of some of this that we already have in stock, that we can piece together and push out. Other things we're doing for specific events, taking whatever the content was supposed to be, whatever we were highlighting at the event, and we're going to be writing that up as a kind of a newsy letter that we can send out to folks with photographs, and doing it around the time of the event. Also, coming up with other, ideas that things that we've backburnered for so long that somebody already mentioned, trying to spend some time on those things and developing them into proposals for next year. So just, trying to keep that events team really busy. And their major work is just, it's not happening.
There's some real creativity there. And as a former art major, I would reflect that creativity comes when you're placed under constraints. And if this is doing anything, it is putting us under some pretty tight constraints, which means it's likely we're going to have to, but I think it's also a hopeful outcome that some new, clever, creative workarounds can actually become meaningful strategies and approaches for the future. So in spite of all of this, it's good to see everyone's face, and I'm glad we could just get together for a little bit just to talk through kind of commiseration and catharsis, but also just kind of what's going on and how you're handling it and all of that. So thanks to everybody, and we'll see if we can do this again in the future.
Drop in there. If anyone's interested, The Washington Performing Arts group here in DC, in 3 days' time, shut down their gala and turned it completely to an online event. They're doing a webinar tomorrow, and I've got a Facebook link if anybody's interested. I can respond to this meeting request, and so everyone can have the link if you're interested. I'm going to put my team, ask my event person to attend the webinar.
Cool.
Cool.
Thank
Awesome.
All right.
you.
All right. Thanks, everybody.
Thank you.
We'll talk to you later.
Everybody stay
Bye.
healthy.
Thanks,
Stay
everybody.
well.
Thanks,
Stay
Mark. Thanks,
Bye.
everyone.
Bye.
Bye.